Hello, today we are going to be talking about Pitocin. Pitocin is a trade name. It is a synthetic version of oxytocin, a chemical produced in the pituitary gland. This drug is important in the mechanism of birth. The generic name is oxytocin, its therapeutic class is a hormone, and the pharmacologic class is an oxytoxic. Oxytocin is a natural occurring hormone while Pitocin is not. It is a synthetic form. It is mostly administered IV, but can be given IM. It starts uterine contractions, it speeds up labor, and/or decreases time between contractions. Indications for Pitocin are for initiation or improvement of uterine contractions in vaginal delivery as well as in abortion. Also, it is used to control postpartum bleeding after expulsion of the placenta. Pitocin stimulates uterine smooth muscle, producing contractions like those in spontaneous labor. It stops postpartum bleeding by contracting, squeezing, and closing the attachment sites of the placenta. It also has vasopressor and antidiuretic effects. Lastly, it stimulates mammary glands, enabling lactation. Pharmacokinetics. Pitocin is administered intravenously or intramuscularly. It results in 100% bioavailability. It is distributed in the extracellular fluid. Only small amounts reach the fetus. Pitocin is metabolized and excreted by the liver and kidneys. Pitocin's half-life is 3 to 9 minutes. Intravenous onset is immediate, the peak is unknown, and the duration is 1 hour. Intramuscular onset is 3 to 5 minutes, the peak is also unknown, and the duration is 30 to 60 minutes. Possible side effects or adverse reactions for the mother include coma, seizures, hypotension, water intoxication, hypochloremia, hyponatremia, increased uterine motility, painful contractions, abruptio placentae, decreased uterine blood flow, or hypersensitivity. The most common side effects we will see with Pitocin are nausea and vomiting. Possible side effects or adverse reactions for the fetus include intracranial hemorrhage, asphyxia, hypoxemia, and arrhythmias. Contraindications or precautions we should have include hypersensitivity, anticipated non-vaginal delivery, maternal factors like sepsis, an unripe cervix, active herpes, multiple births, or previous major surgery in the cervix or uterus. Contraindications regarding fetal factors include immature lungs, cephalopelvic disproportion, fetal malpresentation, prolapsed umbilical cord, fetal distress, placental abnormalities, and threatened spontaneous abortion. When using Pitocin, you want to use it cautiously in the first 2 stages of labor because infusion has caused water intoxication with seizure and coma. Also, it can cause maternal death due to oxytocin's antidiuretic effect. Drug-to-drug interactions. Severe hypertension may occur if oxytocin follows administration of vasopressors. For the induction of labor, Pitocin is given IV 0.5 to 1 milliunits per minute. You can increase 1 to 2 milliunits every 30 to 60 minutes until desired pattern. Once we have it, you can decrease it. The goal for the contraction pattern is 60 seconds every 2 to 3 minutes. For postpartum hemorrhage, Pitocin can be given IV or IM. IV is 10 units at a rate of 20 to 40 milliunits per minute. IM is 10 units after placenta has been delivered. For incomplete or inevitable abortion, 10 units are given IV at 20 to 40 milliunits per minute. Nursing considerations before administration of Pitocin assess fetal maturity, presentation, and pelvic adequacy, and through administration assess character, frequency, duration of contraction, and uterine tone. Also, fetal heart rate, maternal blood pressure, and pulse. You need to assess frequently. Remember, Pitocin can cause water intoxication, so monitor mom's electrolytes. Water retention may cause hypochloremia or hyponatremia. Also monitor for any allergic reactions. Discontinue Pitocin if uterine contraction frequency is less than 2 minutes or duration is longer than 90 seconds, or if there is any fetal distress. Turn patient on her left side to prevent fetal hypoxia, administer oxygen, and notify provider immediately. A nurse is caring for a client who has a new prescription for Pitocin to stimulate uterine contractions. Which of the following interventions should the nurse make? Select all that apply. A. Use an infusion pump for medication administration. B. Obtain vital signs frequently and with every dosage change. C. Stop infusion if uterine contractions occur every 4 minutes and last 45 seconds. D. Increase medication infusion rapidly. Or E. Monitor fetal heart rate continuously. The answers are A, B, and E. A. You need a pump to ensure precise dosage. B. Vital signs are monitored to assess for hypertension and adverse effect of Pitocin. E. Continuous fetal heart rate monitoring is required to assess for fetal distress. The nurse is assisting a client undergoing induction of labor at 41 weeks of gestation. The client's contractions are moderate and occurring every 2 to 3 minutes with a duration of 60 seconds. An internal fetal heart rate monitor is in place. The baseline fetal heart rate has been 120 to 122 beats per minute for the past hour. What is the priority nursing action? A. Notify the healthcare provider. B. Discontinue the infusion of oxytocin. C. Place oxygen on at 8 to 10 liters per minute via face mask. Or D. Contact the client's primary support persons if not currently present. The answer is B. Discontinue the infusion of oxytocin. We have reached our goal pattern of 60 seconds every 2 to 3 minutes. Now monitor closely. Pitocin can cause forceful uterine contractions and decrease oxygenation to the placenta, resulting in decreased variability.